But let's go through causes of cough. The first thing we always think of is drainage. Now there's a reflex on the back of the nasopharynx, the back of the throat. There's a reflex, so people that have drainage can irritate that area, and that can send a reflex to the brain that says, cough. So there's a reflex on that. While we're talking about the nose, sinus disease. There's also the same type of reflex that goes to the brain that says cough. So we have to think of the nose. We have to think of the sinuses as a problem that can cause chronic cough undetected. Reflux disease, gastroesophageal reflux disease, GERD. GERD can cause cough 2 or 3 different ways. Number one, it can come all the way up to the top of the throat, the reflux can, especially if you're laying down in bed, and that can irritate that, send a reflex, and can cause cough. Or the acid that's refluxed can go down on the epiglottis in the area where we can have cough, or there's a reflex from the bottom part of the esophagus. So we have to know about drainage, sinus disease, reflux. ACE inhibitor medications. There's a blood pressure medicine called ACE inhibitor, probably the most common cause of dry, relentless cough. If we stop the ACE inhibitor, we have to be off of it for at least 6 weeks before we know if that was the cause of cough. There's 5 or 6 different families of blood pressure medications, so we can go on other types of medications. There's a cough variant of asthma. Some people that are not wheezing like we talked about on the show, but people that just have a dry, relentless, irritative cough. They may be having some underlying cough variant of asthma. The lung studies, the spirometry can pick that up, or to see if there's a sensitive airway, we can actually induce somebody to have wheezing. If we induce them at an early stimulus, it makes the diagnosis there. Other causes of cough, cigarette smoking. If you're a cigarette smoker, it's time to stop. We know that it damages the heart and the blood vessels, and so it can certainly be the cause of a chronic cough. It's usually a rattling cough. It's usually a productive cough, but it's a common cause of a relentless cough. Abnormal chest x-ray. Some people that have a spot on their lungs, that could be irritating the airway and could be a cause of a cough. So know that there is a workup for a cough. You and your doctor can work through a plan and should be able to get that chronic cough to go away.